Hey everyone, and welcome to The Explainer. If you or someone close to you has been diagnosed with type 2 diabetes, it can really feel like you've been dropped at a huge, confusing crossroads. So today, we're going to look at the map. We're going to explore the different treatment paths you can take, from just managing the condition day to day to aiming for something, well, something bigger. All right, let's get into it.
First things first, let's just get a sense of the scale here. In the United States alone, 34.2 million people are living with diabetes. I mean, that is a massive number. It means that this journey we're about to talk about, it's a journey millions of Americans are on right this very second, which makes this conversation incredibly important.
Getting that type 2 diagnosis, it can be a lot to take in, right? All of a sudden, you're learning new words, your routines are changing, and there's just so much information coming at you. But the main goal, right from the start, is actually pretty simple. Get your blood sugar under control. The real question is, where does that journey usually begin?
Well, for almost everybody, the very first step on that treatment path is a prescription for this drug, metformin. It has been the absolute go-to, the first line of defense, for more than 40 years. Guidelines in both the US and Europe recommend it as the standard starting point.
So how does it actually work? Well, what's cool about metformin is that it isn't about forcing your body to crank out more insulin. Nope. Instead, it's about helping your body use the insulin it already has way more effectively. It mainly does this by, telling your liver to just chill out on making so much sugar, while at the same time, it helps your muscles get better at pulling that sugar out of your blood. It's actually a really smart, multitasking kind of approach.
And this table really shows you why it's the standard of care. It is a proven workhorse. It does a great job lowering key markers like your HbA1c. That's basically your average blood sugar over a few months. Plus, it's incredibly cheap and it's got a fantastic safety record. So from a doctor's point of view, it is the logical first move.
But you know how it is with a lot of things in medicine. There's the textbook version, and then there's what happens in the real world. And for a lot of people, the journey with metformin isn't so simple. This is where that path we were talking about starts to split.
Okay, now this is where things get really interesting. For all its benefits, a whopping 75%, 3 out of every 4 patients, experience gastrointestinal side effects. We're talking diarrhea, nausea, stomach cramps, the works.
And that number isn't just a statistic on a chart, it's someone's daily life. This quote from a patient really just says it all. These side effects aren't just a little annoying for some people, they can be completely life-altering.
And this all creates what we can call a treatment gap. On top of the side effects, which make about 5% of people just stop taking it altogether, the drug flat out doesn't even work for about 30% of patients. And sure, there are other versions like extended release that can help with the stomach issues, but they don't solve the problem for everybody. So what happens to the huge number of people for whom this first-line drug is basically a dead end?
This is where modern medicine opens up a new road. For all those people who either can handle metformin or just don't respond to it, doctors have a whole new class of medications that tackle blood sugar from a totally different angle. They're called GLP-1 receptor agonists. Now, instead of targeting the liver and muscles like metformin does, these drugs work by mimicking a natural hormone that helps your body release the right amount of insulin right after you eat. Pretty clever, right?
And there's a whole family of these drugs out there. You've probably heard of names like Victoza and Trulicity. They are usually injections, and they come in all kinds of different schedules, from twice a day to just once a week. That variety gives doctors and patients a lot of flexibility to find what works best.
And the benefits are pretty compelling. They're great at lowering A1C, but they also often help with weight loss, which is a huge plus. And crucially, they don't really carry a risk of making your blood sugar go dangerously low. Some of them have even been shown to protect your heart. So yeah, they are a really powerful tool for managing the disease.
Okay, so everything we've talked about so far, metformin, GLP-1s, it's all been about managing a disease, using tools to control your blood sugar and hopefully delay complications. But what if the goal wasn't just management? What if the destination was something else entirely? Now we're going to talk about a totally different way of thinking, the pursuit of remission. This quote from Dr. Raj Gupta really nails the whole idea. The philosophy behind remission isn't about treating the symptom, which is the high blood sugar. It's about going after the root cause, the
the insulin resistance itself, and trying to actually reverse it.
So what do we even mean by remission? The official clinical definition is super important here. We're not just talking about slightly better numbers. We're talking about getting your blood sugar levels back to completely normal and, this is the key part, keeping them there for at least a year, all while being completely off any diabetes medication. It's a high bar for sure, but it's a real, measurable goal.
So how on earth is that possible? Well, the secret seems to be in the intensity of the lifestyle change. This slide right here is the real aha moment. Studies have found that when people try a moderate diet, cutting a few hundred calories, the remission rate is under 7%. But when the intervention is treated like a medicine with a very intense, low-calorie diet, look at that, the remission rate skyrockets to almost 50%. It's the dose of the intervention that changes everything.
Okay, so we've just laid out two very, very different paths. One is that well-traveled road of medical management. The other is a much steeper, more intense climb that leads towards the possibility of remission. So the big question is, which path do you choose?
And this really just sums it all up perfectly, doesn't it? These are the two core philosophies we've been exploring. On one side, you have lifelong management, using medicine to keep the disease in check. And on the other, you have the pursuit of remission, using an intense, focused lifestyle change to try and reverse the whole disease process.
And that leads us to the final and most important question. And this isn't just a medical choice, it's a deeply personal one. It really forces you to ask yourself, what does success look like for me? Is the goal to live well with the chronic disease? Or is it to do everything possible to maybe, just maybe, live without it? The answer to that question really defines the whole journey. Thanks for joining us on The Explainer.